everyone. Thank you so much for joining us tonight for the CAPS virtual Botox and facial filler event. My name is Laura Hager. I'm our program director here at CAPS, and I am thrilled to have Erin Marger and Michelle Bloom, our certified nurse injectors at CAPS, here to go over all things Botox and filler for you. So hopefully we'll get all of your questions answered throughout the presentation, but feel free to use the chat button on Zoom. So if you have any question at all, please just send chat. I'll be in the back answering as many of those as I can. We'll also have a question and answer with Erin and Michelle at the end. So any questions that come through, I'll hold for them and they can do some of those at the end. If I don't get to your question, please know that I will email you an answer probably in the next day or so. So we will definitely get everyone's questions answered. You'll also want to stay tuned to the end of the presentation because we do have a fantastic Skin Medica raffle for anyone who's attending tonight. So, and a couple other bonuses. So we will get started with Erin. A little technical difficulty. Well, of course, nothing runs quite smoothly now, does it? There we go. We are all set. Thank you.
Laura, thank you so much for that lovely introduction. Good evening. I'm Erin Marger, certified nurse injector here at CAPS. Thank you so much again for being with us this evening. We know your time is valuable. We're excited to share some really great information to help combat the effects of aging. So we are going to be talking about Botox and Juvederm, which is an entire collection of fillers. Michelle is going to get into that a little bit later. You will meet her here shortly. So first up, we are going to discuss Botox. Everyone mostly has heard of Botox. A lot of people talk about it, but we're going to dive into it a little bit more and talk about maybe you're considering having this treatment done. Are you a candidate? What do the results look like? What does it feel like? How long does it take? We're going to dive into that for you this evening and hopefully answer some questions that you may have if you're considering Botox. A lot of people have. Here's a really fun fact I do want to share with you. 24,000 people a day are getting treated cosmetically with Botox. That's really amazing. There's a reason why. So we're going to talk about that next. So there were some studies done, and most people, both men and women alike, their major concerns when it comes to aging, the big three were the forehead, those stubborn 11 lines between the brows when we look like, we're angry when we might not be, in fact, and the crow's feet lines. Those are the top three areas of concern that both men and women had. So Botox is unique in the fact that they are FDA approved to treat all three of those areas. So they've done a lot of research and spent a lot of money and time to get indications for that. There are other areas that we can treat with Botox. You've heard of, some people you probably have heard of a lip flip. We also do other areas like the little bunny lines between the nose, a orange peel chin or an apple chin that some people call it. Those are just some other areas, a little more non-traditional than the ones that we just talked about, but certainly a lovely effect as well. Why do people ask for Botox by name? Providers trust it, they know it, they trust it. It's been used cosmetically for 19 years now. 8 out of 10 physicians, when surveyed, they actually use this product on themselves or a family member. And the great thing with Botox is it's a really nice, natural, predictable result. Let's talk about dosing. The FDA has approved these three areas that we discussed earlier, the frown lines, the crow's feet, and the forehead lines. Those are the top three. They are all approved in certain doses by the FDA for best outcome with a lasting result of 3 to 4 months. So the frown lines, you're looking at 20 units, crow's feet lines, when we smile, we have all those little lines, and the forehead lines as well, 20 units there. So you have up to 64 units approved by the FDA to treat with Botox. Let's talk about, you might be wondering, what should I expect with the treatment? Big question is, how long does this take? Minimal. You could do this at lunchtime. This is really, quite honestly, a 10-minute procedure. It's very simple, and you'll see that here shortly. We have some videos for you so you can see what that looks like. What does it feel like? It just feels like a pinch. Most patients report that it just feels like a small pinch. And the results, that's what we're here for. We want those wrinkles to go away. So results 3 to 14 days, give it up to 2 weeks for full effect there. At this point in time, we are going to show you some videos. We do want you to see how this looks when you come in the office for treatment. So join me as we watch this video. Here's a CAPS patient receiving Botox injections to the crow's feet and the forehead. And you can see just how quick and simple this procedure is. Like I said, a lot of people can easily do this at lunch, at 10 minutes. Here's another patient, same thing. You can see she's getting her crow's feet treated there, and also getting injections there for the 11 lines and a little bit in the forehead. Quick, very minimal downtime there. This is an interesting video here we're going to show you. This is a patient that's receiving Botox to the masseter. This is one of those other areas that we discussed. There's 2 reasons why people look at this. Have you ever suffered with TMJ? I know I personally have, and it is it can be quite painful, TMJ. And we want to stop grinding our teeth and ruining up those lovely teeth of ours. And also, you can also do this for facial slimming. Some people do it for both, so that's a lovely treatment as well. Now we're going to go into actual photos. So you saw what it looked like during a treatment, just how quick and easy it was. But let's look at how this looks. Again, day 7 here, this first lady, she had her 11 lines treated there between the brows. You can see she's has a maximal frown there on that first photo on the left. And after day 7, look how lovely that is. You can tell her eyes even appear more rested and open. I love this picture of crow's feet. Right now we're all wearing our masks, right? So what is the first thing that people see? They see our eyes. So, the effects of time start to take toll on us. Smiling, which isn't a bad thing, but the lines that it leaves behind can be not so nice. So really the crow's feet's fantastic because it really helps give you that nice youthful eye, open that eye up. Here's a 30-year-old patient treated with 28 units of Botox. We would love for you to come in the office. You're going to see, as I'm going through some of these photos, that these patients, we have different ages, different doses. We will customize a plan that fits you. It's not the same for everybody. It's unique to your individual needs. And Michelle and I would be delighted to help you with that process. So here you see a 30-year-old patient. You can tell she's been treated between her brows with 28 units of Botox there. And you can see the lovely effect that she's had, how nice and smoothed out that is there. I love the forehead photo here. What a nice natural result. You can tell the brows are still elevated. We don't have, it's not taking away from the look of the brows. Foreheads, again, we would love to discuss that with you on consultation because that is an area that everyone's dosing is very different there. Here's another forehead, a 32-year-old patient treated with 30 units of Botox. So you can see the top there when she raises her brows, that rippling effect up there. And on the bottom, you can see how nicely that's smoothed out. A lot of you can relate to this one as well, especially over this last year. We've had a lot of frowning, unfortunately. And the top picture you see there, the patient has the furrowing of the brow. We call them 11 lines. They almost really, if you look closely, do look like an 11. And you can see how nice and natural and subtle that result is. We're going for a healthy look here, not a frozen look. So very natural, very nice. Here's a 32-year-old patient as well, treated with 30 units of Botox. You can see she's got that angry look. And it's interesting. I've had a lot of patients come in and say, I'm a really happy person. And people just assume that I'm grouchy because of these stubborn lines. And we see that a lot. And when they get treated, they are so happy because they feel like, people aren't judging them and thinking that they're angry all the time. So that's something really nice to look forward to as well. I love this slide. Here we have a transition. The very first patient, the photo that we have here, the patient's raising her brows And you can see in that second picture, she's also elevating her brows, but she's no longer has the wrinkles there. And it looks natural and it looks healthy. The same with her when she's furrowing her brow, same thing. Nice and smoothed out, nice and natural. This is a 38-year-old patient with 48 units of Botox. So we probably have some treatment in between the brows, forehead. Again, we'll customize that for you. But what I love about this picture is you can just see the brow placement. Some people are worried, my brows are going to be too high, or I'm going to look frozen. And you can see that's not the case here. That's just a really lovely natural result as well. A 32-year-old patient with 30 units of Botox. Again, you can see you might relate to this and say, yeah, that kind of looks like me. And on the bottom there, look how lovely and softened that is. We have one more video here we'd like to share with you, just to kind of reiterate how simple this procedure is. This patient here, our lovely patient getting treated for crow's feet and the forehead. And again, really in just a very short period of time, she's able to come in probably on her lunch break and get this done. So very nice. To wrap this portion up about Botox, we just like to say again, we do love to choose Botox here. 18 years, the #1 product of its kind. 30 years of experience. They've had a therapeutic indication for over 30 years, 18 years cosmetically. So that's quite impressive. And that is one of the big reasons that we here like to use Botox. Before we kind of get into, Michelle in just a moment will be joining me. Actually, due to social distancing, she won't be joining me. We are going to change over, but I just want to briefly go over, as we age, kind of how that looks. We're going to just talk about fillers. So we talked about Botox being the wrinkle relaxer. We're going to go a little more skin deep and talk about fillers for more structure and support. But let's just briefly look at how, kind of understand how the face changes as we get older. I love this example. This is really great. And some of you might be thinking, yeah, my daughter, yeah, I looked like that when I was her age, right? But the nice thing is you can be the 26-year-old and get prejuvenation with Botox to avoid deep creases and wrinkles, or you could also at 64 get Botox. So there's something for everyone here. So as we age, we just really, you can see the mother on the right, those fat pads in the cheeks have dropped. Gravity takes its toll. We have drooping. A lot of people will call it jawing. We have sagging there, double chin as well. So we talk about the triangle of youth. The daughter here on the left, you see that lovely triangle of youth, the high cheekbones, the defined jawline, beautiful contouring. And then as we age, and like I said before, as time takes its toll on us, we kind of start to lose some of that support. Fillers is a great option to kind of help build up some support, give us some contour, give us a little bit more of a youth back. So I'm gonna, at this point, turn it over to Michelle, and she's gonna talk to you about filler. Thank you so much for your time. We really look forward to seeing you here at the office to go over your individual consultation. Thank you so much. Michelle, take it away.
Thank you, Erin. Hi, everybody. My name is Michelle Bloom. I'm one of the certified nurse injectors here at CAPS. It is a pleasure to be here tonight. So thank you for logging on to see what we have to talk about tonight. So I'm going to jump into the facial fillers and why we would use those options. First, let's start. What is a filler? So fillers are made of hyaluronic acid, and it's a naturally occurring molecule in your body. It's actually a sugar molecule. And what it does is it absorbs water. So when placed under the skin and injected there, it will help absorb a little water, fill in that crease, that wrinkle, and make a smooth appearance to the skin. It's just a clear gel that goes right under the skin. Again, very natural. Some of the areas that we can use are cheeks, lips, the wrinkles around the mouth, and the lip lines. Why do people choose fillers? So it's a great non-surgical option to get that youthful appearance. You get instant results. You can actually see it immediately after your treatment's done. It's a natural look and it's long lasting. There's 5 different filler products that we use here at CAPS that are all a part of the Juvederm family. There are the 3 V's I like to think of. So Voluma, Velour, and Fobella. And then there's the original 2, which are Juvederm Ultra and Juvederm Ultra Plus. You may have heard of these before. Let's talk about Voluma and specifically what it's used for and why we would use it. So we talked about the aging process and how as we get older, we start to lose that volume in our cheeks. Skin starts to sag, the cheeks start to flatten. We notice that the creases by our nose become more prominent, and it's all because of this loss of volume. So if we add a product like Voluma to the cheeks, we can help offset that appearance while restoring volume here and giving that inverted triangle appearance again, that youthful look again. The other great thing about Voluma is it lasts 2 years. Here's an example of that lifting and contour look. You can see in her before photo, that curve around the cheek is a little flatter, that we knew that we could achieve more. So after a month, you can see where the filler is, gives a little bit more of a curve there. And then even after 2 years, she still has that. Straight on, not only can you see the volume of her cheeks, but she also has this youthful appearance because now we've corrected the underlying cause of those nasolabial fold lines. So take a look by her nose. You see that shadowing. That is also from loss of volume in the cheeks. So by restoring that, you can tell that that is a much less noticeable appearance. Next up, we have Juvederm Velour and Juvederm Ultra Plus. So these are great products to help smooth the lines on the lower part of the face. So for example, the nasolabial folds like we talked by the nose, there are the smile lines that we get, there's the marionette lines that come down from the corner of your mouth, and those can all be treated with Velour or Juvederm Ultra Plus. When do we pick either of those 2? Well, the indications for both of those are for those areas, but it just depends on how much volume we want to have replaced in that area. So for example, Velour is a very smooth product that when placed in that area will enhance it very conservatively and subtly to that line. If we need something with a little extra volume, then we might go with a Juvederm Ultra Plus. Everything's customizable, and Erin and I would definitely love to have a conversation with you to determine which products would be best for you. The great thing about these is they last at least a year. The Velour actually has an indication to last up to 18 months. Here are some before and after photos, and you can see subtle volume to smooth the lines. So the before photos show you the crease again around the nasolabial fold. Immediately after, actually about 1 month after, you can see that result is there. Same with the before photo in the second set of photos. Again, the lines around the mouth kind of coming down to that marionette line helps that as well. And this is with that Velour. Here is where Juvederm Ultra Plus was chosen. The lines around the mouth just required a little bit more volume. So we would recommend something for this patient to be like a Juvederm Ultra Plus, a little extra, a little bit more filler attractive, it's going to attract a little bit more of that water there to give these great results. And here again, this patient had the Juvederm Ultra products in the nasolabial folds and around down by the marionette lines. And you can see even after a year, she still has results. Now let's talk about Fobella and Juvederm Ultra. These are sort of the smallest particle size and good to use in smaller areas. So for example, Fobella, this is going to be something that you would use for the lines around the mouth, specifically the lip lines. Like a lot of times we call them smokers lines, but it's not even necessarily from that. It could just be from using straws often, or the way we talk and we're making that motion a lot. Then we get those unwanted lines above our top lip. So Fobella is a very small particle sized product that can be put right into that area beautifully. It can also be used in the lips, which is a great enhancement and hydration that you would notice. Juvederm Ultra, a little bit more volume there. That would be great for a little bit more plump lip, a little more of a pout, if you would. which a lot of people are going for. Both of these products can last up to a year. Here's that subtle volume change with the Fobella, like we were mentioning. You can see again the progression that, you know, her before photo, her 1 month photo, and even a year later, she still has that enhancement. Take a look at the top of her lip. Those are those lip lines you're talking about. You can see how they're noticeable there in that before photo and practically gone in that second photo. She also has a little bit of that in her lips as well. You can tell that it's not a drastic change, but enough to just look enhanced. Still want you to look like yourself, just a more youthful, enhanced self. Here is where we're going for a little bit more plump lip, where we would use a Juvederm Ultra. So you can look in the before and afters of both of these women and see that change. I also want you to be aware of those little lines in the lip. Those are sort of these cracks and creases that we get when we're dehydrated. So what does the hyaluronic acid in the filler do? Absorb some water. We're going to restore that hydration. You can clearly see how beautiful that looks when we can restore that. Here, I'm going to play this video for you, is a patient of mine that had Voluma done to her cheeks, and you can see she's relatively comfortable. She's just relaxed. It's a very quick little injection. Honestly, afterwards, all I advise is to ice the area for the first 24 hours, sort of on and off, to reduce any sort of swelling or chance of bruise. We do recommend to avoid vigorous exercise just for the first 24 hours while it's healing. But that's pretty much it. All of our filler products have the XC at the end. You may have noticed that. What XC means is extra comfort. And that means that they all have lidocaine in it. And so when she's receiving her injection of the filler, it actually already has lidocaine in it to make for a very comfortable process. Let's give you some before and afters. So this is one of our actual patients at CAPS as well. And you can see here she received 2 syringes of the Voluma. And you can see that how the cheek has the enhanced curve. And it also has a fullness to the apple of her cheek. Looks very beautiful and natural. This is a patient that received a syringe of Velour to her nasolabial folds, and you can see the before and after. This is immediately after. She also received Botox to her forehead, which, you know, if you're wondering too, like, oh, I really do want to do this on my lunch break, what does it look like? Just looks like a small little red area to the injection site that goes away within an hour. But yeah, beautiful results with that Velour in the nasolabial folds. We also have another patient here who had 2 syringes of Voluma in her cheeks. Pay attention to close by her ears. You can see that curve around the cheek that was enhanced on both sides there. And again, she's young. Are we really restoring a lot of volume loss that she had over the years? Not necessarily, because she's young. We're actually just enhancing and adding a little bit more contour to that cheek. What do we try to achieve with our makeup? That contour look. So this will make it much easier. Here's another patient who had the 2 syringes of Voluma to her cheeks as well, and some Botox. You can see in that before and after photo, she's barely even pink. She went back to work right after this as well. Looks great. Velour again for the lips. You're gonna get 18 months with this product. Gives that smooth, beautiful, soft enhancement. More Velour to the lips. You can see how the pink of that top lip is showing more, and that's that achievement to sort of give that fuller appearance. Hey, here's a great photo. Who doesn't love having a great selfie? So here we are, before and afters. We want those beautiful lips for the beloved selfie. Another Velour before and after, beautiful. And this is immediately right after too. Beautiful, beautiful plump lip. We were talking a little bit more about the juicier sort of pout. Here we have the Juvederm Ultra. We will tailor your treatment to whatever it is that you would like to achieve. So when somebody comes in and says that they do want a fuller pout, this would be the product we would recommend. And here we have just the 1 syringe of Fobella. You remember me talking about how it's just a smaller daintier product. This is a great starting point for anybody who's a little nervous about adding filler to their lips. You're going to get a beautiful enhancement that we can always add to if you ever want to. This is going to be the best one for when you're just trying to step into the filler pond for the first time. So again, why do people choose fillers? Because it's a non-surgical treatment option to help restore the youth. You get instant results, they're natural looking, and they're long lasting. Erin and I, like we've said, are offering no-cost consultations to you to come in. We can talk about your treatment plan and your goals, and we can help us come up with an aesthetic plan that is going to be best for you. One other thing that we do here have at CAPS is the Alley program. You may have heard of this before. Allergan has this Alley program. Allergan is the maker of Botox and Juvederm, and every time you use their products, they give you points, and those points can be turned into coupons. So here at CAPS, we will manage all of that for you so that you know when you have money to be used, and you will know when you have the points there too. So it takes that last step, the one less step for you when in managing this. You may have heard of Brilliant Distinctions before. This is that program. They changed the name. All right. I'm going to turn it back over to Laura, who's going to talk about our awesome Skin Medica giveaway.
Perfect. Thank you so much, Michelle. That was fantastic information. No matter how many times I see those photos, I still love looking at them. But I do want to let everyone know that we do have a Skin Medical raffle tonight. Skin Medical is one of the advanced skincare lines that we have here at CAPS. It really makes a huge difference. If you're going to invest in your skin, you really owe it to yourself to use a great skincare line. So Skin Medica is fantastic, and it really helps improve the results of any injectables that we would do. They are offering a $400 tote as a raffle today. It's amazing. So it's a cute, clear tote bag filled with Skin Medica products that you'll absolutely love. You don't have to do anything to enter into the raffle as long as you're logged on tonight. Anybody who logged on is already entered. So I will let the lucky winner know tomorrow. Something else that we've done, they also have, when you schedule either a treatment appointment or a consultation, and you're registered for the event, everybody's going to get a little Skin Medica gift bag. It has some travel products, so you can try some different things out, as well as a coupon for 25% off one Skin Medica product. Now the question everybody's been waiting for. I've got so many of these on chat, so want to get right into it for pricing for Botox and filler. So with our certified nurse practitioners, nurse injectors, Botox is $10.50 per unit. And again, you really need to schedule a consultation. Everyone is different depending on your facial structure, your age, your skin type. Everyone's going to need a little bit of a different amount to get the results that they're wanting. So please schedule a consultation, give our office a call, and we can get you in at Easton or Upper Arlington. And they'll be able to tell you exactly how many units would get you to where you want to be. As far as the facial filler. So facial filler with our nurse injectors, it ranges depending on which type of filler you're interested in. So anywhere between $550 and $800 per syringe. And again, that's just a variance if you're using Velour or Voluma. There's different prices for each of them. They are always buy two, get one free with our nurse injectors. So if you do have a couple areas that you want to treat, we've got you covered there. That pricing is for our certified nurse injectors, and it does vary from our board certified plastic surgeons. One thing before we get into the question and answer, I just want to make sure everyone knows, remind you of our office phone number. It's 614-246-6900. And you can give us a call and we will get you scheduled at either the Upper Arlington or the Easton office, whichever is most convenient for you. We can get you scheduled as soon as possible for, again, either a consultation. No cost consultation is part of the benefit of logging in tonight. Or if you know you definitely want to go and get that Botox or the filler, we've got you covered there too. We'll get you scheduled right away. So now I'm going to get into some of the questions. So we had a lot of questions come in, so I'm going to kind of go through these. We are all in separate rooms, so I'm just going to call out and go back and forth. So first question, Erin, I'm 55 and have never tried Botox or filler. Will it work at my age? I can relate to this one.
That is a great question. As you saw in some of the examples we had earlier, 55 is not too late. Again, come in for a consultation so we can make a determination of how we can best suit your needs. But 55, absolutely not too late. We can do improvement with both Botox, fillers, one or the other, or even both. But come in, please, for a consultation, and we'll discuss that in more detail.
Perfect. Thank you. Michelle, this is a good one. We get this question at the office, as you know, all the time. How long before a wedding or a big event should I try Botox or filler?
Good question. So as Erin mentioned, it does take up to 2 weeks to fully kick in. So anything before that, you're not going to really see the results yet. But if you're going to be getting married, at, say, in a few months from now, it might be best to come in now, get a couple treatments in. That way you can figure out what is the best dose for you and that you know that you love your results before that big day.
Perfect. Absolutely. This one, I'm glad somebody asked this because it's such a common myth. Erin, I've heard my face will look frozen with Botox. Is that true?
Yeah, you hear that one a lot. You know, people have seen that. I mean, is it possible? Absolutely possible, but that's not the look that we're going for. The goal is a healthy look. Certainly, we will devise a plan for you. We or make it very clear what your needs are. And frozen, we're not looking for that for you either. So come in, see us. We'll come up with a plan, but absolutely, we don't want you to look frozen. We want you to look natural and healthy.
Perfect. This one, I have to interject my own little story on this, but somebody asked, I feel like my face looks grumpy because of my frown lines. Will Botox fix that? And just my own little personal, I felt like I was a really happy person, but I had such deep lines in my forehead. It was really making me look grumpy. So my friends actually got me my first Botox treatment for my 40th birthday, which I don't know if I should have been offended or not, but I was thrilled, and it made me look how I feel. So Michelle, can you speak to that? How does it help if you're feeling like your face looks grumpy?
Yes. So exactly like you said, sometimes we're making this face with the 11th and that mad face. We don't even know we're doing it until we notice one day that there is a wrinkle there. So yes, absolutely. Botox relaxes that muscle, so it prevents you from being able to make that movement. So yes, it will make those lines much more subtle and make you look much less grumpy.
Erin, here's a good question. Can I get Botox or filler Botox and filler at the same appointment?
Yeah, we do that quite often, and that is a really good question. Certainly, if you feel like maybe you want to do both, just let us know on the phone call. We definitely want to make sure that we have time for you, but it's absolutely something that they can both be done at the same visit.
Perfect. Oh, Michelle, this is a good one. Do wrinkles come back if I quit getting Botox?
Good question. So Botox is indicated for a time frame of about 3 to 4 months. And because it's a muscle and it's strong, it can regenerate that muscle to make that strong movement again. So we usually do recommend getting the treatments every 3 to 4 months so that you're not getting all that strength back, but it certainly could come back, but that's why we try to keep up with it. And we do remind you of when your appointment's coming up, or we even say, hey, just make your next appointment at the 3-month mark so that you're ready.
Oh, good. This one, Erin. I bruise easily, and I heard that if I get filler, I'm going to bruise. Is there anything I can do beforehand to prevent it?
That's also a great question. Certainly, as Michelle discussed earlier, you can get bruising with filler. But the thing of it is there are things you can do to avoid that. I would recommend 3 days before your treatment, fish oil. Some of the culprits could be like ibuprofen, Aleve, things with naproxenum, those things. And honestly, if you stop taking those 3 days before, you'll have much less likelihood of bleeding. And then things like avoiding alcohol after treatment. That's a big one too, because that can increase your swelling and bleeding. So there certainly are things that we can advise you on to avoid that.
Absolutely. Michelle, somebody had just asked, and I want to expand on this. I had a facelift a few years ago. Can I still get filler? And I think we can expand on that and say if you've had laser procedures done, or if you've had maybe an eye lift or anything in general, are you able to still get filler?
Yes. The answer is yes. Usually if you had just had a laser treatment, we want to make sure the area is healed before injecting in that area. But otherwise, if you've had a facelift and now it's a few years later and you're ready to enhance it a little bit more, no problem at all.
Perfect. Erin, last question. And again, I want to say if we didn't get to your question or your chat question, we will get to those over the next couple of days, and I'll be emailing a question answers for you. But I had a lot of questions come through about preventative Botox. So Erin, if you could just speak to, does it help to get it earlier, and does that kind of put off getting wrinkles down the road?
That is such a good question, Laura. And we do see that a lot. So again, Botox is great for all, adults really of all ages, but preventatively, it's fantastic realistically, because think about it. If we start frowning and our muscles are moving and they're contracting and they're, you notice it's like if you fold a piece of paper over and over again, the crease, it will continue to get deeper. So by stopping that interaction, we're not going to have so much of the deeper lines of wrinkles. So if we can prevent that at an early age, you're off to a really good start. I mean, genetics plays a role in everything, but realistically, if you're younger, wondering is this for you, preventatively, it's fantastic. I've seen it play out very well. I started getting my Botox personally in my early 30s, and I didn't realize that if I could have maybe gotten in my 20s, I would have had a better handle on the lines of wrinkles. So yes, please come in. We will adjust the dosing. The consultation would be great for you. Let's talk about that. And we'd love to see you soon.
Okay, I know I said last question, but one more, just because I've had a couple on chat. Michelle, how long does Botox last, and does it matter how many units? So if you could just speak to how often do you have to get it, and once you get it, how long does it last?
Good question. So Botox should last anywhere from 3 to 4 months. And so that is roughly how often you would get it. When you start to notice that muscle regaining that strength, making that crease again, that's when you know it's a good time. Dose, what was your other question? I'm sorry.
And does it matter how many units? If
yes.
you get more units, does it last longer, or is it still 3 months?
So in regards to, thank you. So in regards to dosing, we do have this little caveat that we say that dose equals duration. So if we do a specific dose on your first day and you've never had Botox before, doesn't mean that it's necessarily the magic dose already. So at that 2-week mark, you're like, I think I need a little more. No worries. Then you come back in, we'll figure out what then your next dose will be for that next time. So yes.
Perfect. Well, all set. Like I mentioned before, we do have some more questions on the Q&A, and I will get to those in email. Please call our office. Our phone line's open tomorrow morning at 8, so they are off at 6 o'clock tonight. But our phone line's open up tomorrow at 8, and please call. And again, it's the same phone number for both locations. So 614-246-6900, and we'll get you scheduled either at the Upper Arlington or the Easton office, whichever is most convenient. And thank you so much. We really appreciate your time tonight, and we look forward to seeing you in the office. Thank you.
Thank you very much.
Yeah.